The Court of Public Opinion is a part of the Amateur Radio Network. The topic is a chemical lobotomy, and if you don't know what that is, in 1970, this was one of those wonder drugs, Thorazine, which you probably could see that the DSM, the psychiatric DSM, which has been over time changed a lot of medications, but going back to 1956, if you know the history of pharmacology or pharmakia, it even goes further back to uh, which we know during the time of Adolf Hitler's reign, the Third Reich. And these drugs were all promoted on TV in 1970 as the happy pills, or more or less used and marketed towards a uninformed, uneducated populace. And because they had the name chlorpharazine, I apologize if I didn't say that correctly, many of the psychiatrists and doctors today know the history that some of these medications were really just using what they know is a chemical lobotomy, meaning that a lot of the diagnoses back in that time and even today, they still use a lot of these chemicals. That's why you're supposed to read the pamphlet and really get to know what kind of drugs you're introducing into your body. And a registered nurse here, and I'm going to put the article and information below, but this is a very good documentary. But if you really dig away at this topic, you'll know that most of the people that have been on any antipsychotic drugs, and when you think of all the vaccinations and all the crippling illnesses going back to the 1930s when they were giving out the polio vaccination, how many people were crippled by it, and even a president of the United States as well. But they still continued to pump a lot of these medications in. In fact, by the year of 1970, this many people were on Thorazine in 1970. That's amazing. So that's just one drug, though. That we're talking about Thorazine. If you ever heard about the Thorazine shuffle, I mean, they literally became comatose. It was a chemical lobotomy. And if you don't know what a chemical lobotomy is, it literally shuts down the frontal lobe. So now today we deal with trauma patients and these people that are dealing with medical problems. It's not to say that there aren't medical issues. That's not the issue. It's just, crippled people over, literally over decades. But it goes even further back than that. You think back to the ancient Egyptian time period where they used all kinds of chemicals. They used leeches, anything they could get their hands on to remove any disorders and disease. You weren't born, a lot of people are not born with these conditions. I was just talking to a young girl who's pregnant, and I just told her to read the pamphlet before you okay that, because a lot of doctors will agree. A lot of patients, they don't read their information, or they go in uninformed, and then something happens. But I was just reading several posts where people are handicapped and paralyzed as a result of the side effects. I mean, it's not worth taking the risk, because some people are now diagnosed with chronic illness. I don't know exactly how you can make the distinction if fibromyalgia might be as a result, but look at all the chemicals that your body is exposed to. They talk about free radicals. They talk about all kinds of other diseases that come as a result of drinking colas and anything with artificial flavors. I mean, there's a whole major scientific study based on the effects that some of these chemicals have on your body. But yet many of us, because we're not informed, or we don't know what we're eating, or we're not paying attention, or it's hidden sugars. Another health condition called candida. If anybody has like sugar issues with sugar, a lot of times the yeast in the body, what it does is it's a cell, and that cell, which if you know the science behind it, if you ingest sugar into your body, it has the ability to extend your waistline. So most of the people that walk around with aches and pains, a lot of it has to do with the acidic level. Your body's not at its normal pH, and there's a lot of things you can do without even having to take a pill or medication to adjust your body. But it gets to the point where people who have, gained weight or don't exercise, they become severely depressed. They just stay stuck, and they really can't they physically need help. They actually, by the time, a disorder or health condition is not properly diagnosed or properly treated, they may have lived with this condition for years and didn't know it. I mean, a lot of times today with what some of the things that are in our water to what's in our food have a lot to do with the developmental process of tumors. It was getting to the point where when I would go to the doctor at a clinic, they were saying that it was actually normal for women to have fibroid tumors. But if you were to ask my aunts back in the day, they grew up in the era, the post-war era, and they didn't have these issues. Women didn't have PMS, believe it or not. But looking at what's happening to men and women, I mean, you're exposed to all these chemicals. You drink water, and there's things in the water. I would go a step further. A lot of people don't really, really pay attention to this, but if they do, they might get to the bottom of a lot of their problems just by getting educated and knowing how to. But if you have a chemical lobotomy, some of these people, the reason they shut down the mental health hospitals is because they were literally giving chemical lobotomies. I watched my grandmother die this way. And I was pretty stunned that a lot of people just sat back and went along with it. I was like, she literally was crippled to death. I mean, she died crippled. And you can see that there was adverse effects and symptoms as a result of the way I can't say for sure, but the medication she was on had something to do with her being in that crippling condition. You don't just become crippled unless something was introduced into your body. And she lied there, and she pretty much died in the hospital. And I know a lot of people watch TV, and the marketing is just so. We've been conditioned to watch the TV and the news, and we don't think twice about it because there's a normalcy bias. Part of you is like, I don't want to really you don't want to make that jump, but unless you're directly affected by it, and unless you really look at it, you don't want to deal with it. You don't want to know this part of humanity. But unfortunately, they tested all these medications on the Jewish people in the concentration camps. Okay, so when I did my book report in 1986, I was a 16-year-old. I was coming home on a school bus, and I just thought, did anybody really know what happened to these people? And I had to do a book report on the concentration camp, and I could not believe that there were people that died this way. And I mean, it was pretty horrific. And so I grew up in the 80s, so of course, whatever our parents told us or didn't tell us, a lot of people didn't talk about World War II. They didn't talk about what was going on when they went to Iwo Jima. They didn't tell us what the reasons were, what battle they fought in. We knew that much, but we didn't know a lot of things, because a lot of people didn't talk about what the war was like. And even today they talk more about it, but back then they didn't talk about those things. You just didn't ask, or you read it in a history book or something like that, But a lot of these things were tested, and they were in our history books, and we actually read it in our civics class about government and world governments and things like that. And if you actually take the class, or if you went to high school and you read in your civics books about the Treaty of Versailles and so many of the reasons why these countries still today, I can't identify with every reason or what treaty was what, but one of the treaties in the United States was the treaty regarding the end of World War II. And I had met a woman who lived in a concentration camp, and she was found by the American soldiers at 6 years old. She weighed only 18 pounds, and the experiments that they had done on them, and just the things that, I mean, I couldn't do anything but just sit there and listen, because it was just an incredible story of survival. And so a lot of the World War II survivors, the concentration survivors at Dachau and Auschwitz, they told stories that were just incredible. And it was all these experiments done on these people. And, over the last 25 years, I often wonder what would happen in America if we didn't pay attention to our history, or if we didn't look at what was going on in the world today. And gradually and slowly we were conditioned and rocked to sleep. And a lot of people have woken up over the last 10 years, and they're asking all kinds of questions. What happened here? What was this about? And the crippling effects of disease, and why, the etiology of disease. Where did these diseases originate from? And all these other pandemics we've heard about, and the fear factor. And how do you treat these individuals who, you never know what their healthcare profile is. It's hard to say, because if you take these vaccinations over a short period of time, you can literally be crippled. And that was my situation. I was paralyzed after a series of shots in 1991. And I started to get angry because I was trying to tell them, and a lot of people would not listen to me. And unfortunately, I literally barely could learn how to walk again. And I barely knew how to talk for myself and speak for myself. And I was severely handicapped by it. And I was angered because people were pretending like this didn't happen. And my friends were at the hospital bed, and I had people show up and say, what happened to you? And I said, over a period of time, I decompensated. I no longer could function, and I literally passed out, and they gave me a spinal tap. And I know what it happened, because there's no other way to explain it. And I was supposed to go into AIT, and I had a series of shots, and I was crippled. I was paralyzed, and I lost the ability to function and do a lot for myself. And I really, really am angered that most of my adult life I've been crippled by disease or illness or something as a result of things that were administered to me. And one of the bad reactions I had was to one of the drugs that was administered to me, and I gained like 80 pounds. I mean, almost overnight. I mean, I'm 128 pounds, and I go from 128 to I shoot up to 228 within like a couple months. And all I was told is that I ate too much. And I was like, yeah, right. Meaning that the medications and a lot of the adverse effects had a lot to do with my using these medicines. And I didn't know it. And finally, I met with a doctor in Kansas City who slowly helped me gradually get off these medicines. And I still live with a lot of health problems, but I treat a lot of things with vitamins. I'm on a vitamin schedule. I mean, I have to tell you, it's been a crawl coming back from it, and there's things I deal with, and I have to deal with it. But at least I can say that there is hope if you get into a strong vitamin regimen and you really do your homework and you look for other alternatives and you read the labels. That's what it comes down to. I can't tell people what they can or can't do. Some people might say they've had a positive reaction, but for me, my situation was that I had tumors, and I started getting sicker and sicker, not better at all. I've also talked to people on psychotropic drugs that they were suicidal all the time. And I also know that there's other factors involved. But usually when people are that suicidal, I know it's either a couple things. I'm thinking they're not on a vitamin regimen. Their probably nutrition is tanked. They're probably being neglected to some degree. They're not getting the right proper care. Something's going on here. Because there were a lot of indicators to me that these people were sick, and it wasn't always about a biological component. There's factors involved. There's environment. There might be, family problems. There might be just, a recent death or losses. So there are factors involved. But I mean, a lot of people, they assume that if you go to a therapist and doctor, that's the answer. And a lot of times you do need to talk to the counselors. You do need to talk to somebody, but they have to be informed on the adverse effects of these drugs, and you don't have to do anything. If once people start getting into the situation where they start forcing people on psychotropic drugs, it's dangerous, because as I said, there's a lot of times somebody goes into a hospital and they end up with a lot of problems they never had before. So that's the risk a lot of people are taking, and that's a huge responsibility to sign your name to something. And these people walk out literally handicapped. Healthy people literally chemical lobotomy. I have real issues with it because it's unethical, it's immoral, and to literally treat somebody like an animal. I mean, that's why I think when you look at these cases and they go into discussing about false imprisonment, you can't falsely imprison somebody just because you disagree with something or you don't think they're getting the right kind of care. My problem is a lot of these people that do that, they're also not involved in their overall treatment. They're not regularly taking them to the doctors. You're not really participating. And a lot of times when somebody gets into the situation where they start, I don't know, they call it involuntary institutionalization. A lot of times they're doing it for nefarious reasons, sadly enough. And a lot of times with the judges, they throw the cases out because they know that this is not really about somebody being sick, but it might be some esoteric, nefarious reason. I mean, if you really care about somebody, you want them to get the right kind of care, you're going to get them on a nutrition plan. They're going to be on a vitamin schedule, and they're going to get to the doctors, and they're going to see who they need to see. But you're not going to just throw them into a psych ward. And that's been the problem for about 50 years. And that's why they shut down these mental hospitals. And in fact, if you listen to some of the really amazing investigative reports, one from Geraldo, what they would do. And there are some countries that they do this to children that are orphans. So, I mean, it's definitely still real. It's still going on. That's the worst part, is that instead of taking care of people the way you need to, it's a profitable industry. And it's another way to avoid responsibility. I mean, one of the things I think about humanity is that we're supposed to be here to help each other, walk with each other through struggles, and instead of throwing somebody in a psych ward and labeling them with a problem, I mean, it takes the humanity out of it, and no longer is it like connecting to another person, but you lack compassion, and in this world, it's pretty cold out there, and I often wonder why is it so cold? Because people label people with these problems. They forget about the person. They just put a label on them. I've gone down to, some of these programs where, there's handicapped children. They don't have anybody. And it's like, I mean, I just want to, and they're innocent human beings, with purpose, and their lives matter to me. And, I've gone into shelters where, I've actually treated 20 different people with turmeric. It's incredible. Like, I think every day I want to get up and do what I do at the field report, because I know there's somebody that's either dealing with chronic homelessness or, disease, and it can easily be treated with vitamin D. You know what I mean? I'm not saying that that's a magic pill. There's a magic cure, but you got to take the red pill here, And the truth is that there are a lot of people that needed care a long time ago that never got the care they needed. So when we go out in the field and we respond to problems as a trained combat medic and paramedic and medical assistant, I just sense, instead of just waiting around for them to get to the doctor, we're going to go there and, treat their wounds and take care of them and go out there, and whatever supplies we have. Now, I have to tell you, funds get low and, we run out of money, but I always try to keep a supply. The only difference this time is that I had setbacks and I got really sick and I ended up having surgery. But if a year ago, that's what I was doing. I was going to shelters and I was just treating them right there. And I just love what we do at the Field Report, and I hope you support it. But, it's just to keep our, paramedic bag. And I was working with a couple people on working at a paramedic bag where we could sell it to the public, where you would have enough supplies. If you were camping, it would be right there. You wouldn't even have to go to a pharmacy because you would have it right there, or a clinic. A lot of things you can do if you're like out and about. And this is all stuff that I've compiled from, firefighters to Navy SEALs to people that work in the field, nurses and doctors. And there's a lot of things we can do that we don't need to have access to all these elaborate medications. There's going to come a time, if you can't get to medicine, you're going to have something, to treat somebody in the middle of a crisis. And I know there's going to come a time that's going to happen. That's why we want to put together this medical bag. And I really hope that you all would support us at Patreon, because we're going to make sure we're equipped. How equipped we are, it's just going to depend on the people that work around us. If we're ill-equipped, it's not because we haven't tried. We've done everything we possibly can to make sure we have extra medicines, vitamins, anything that we need, bandages, splints, I don't know, tourniquets, anything I can shove into my truck. I'll make sure I have it. But I just know I know, having learned so much from recent crises, that one of my goals was to go down to Canton, Texas and help treat them, but I still had some setbacks and things like that. But I learned a lot when I went to Joplin, Missouri, on debris detail and the kind of health conditions and what they were breathing in. And my ex-husband, his cousin was at Tower 2. He worked for he was a fire chief at FDNY. So I learned a lot from the bucket brigade. Some of the chemicals they were breathing in, the plastics, the highly toxic things they breathed in, was incredible. And I learned this over the last 10 years. It was a lot to learn, but we do get exposed to, and even when you burn certain plastics, you're breathing in these fumes, and no one really thinks in terms of like, oh, this is going to have some kind of adverse effect. But that's been the case with first responders on the pile on 9/11. So that's the aspect that that's where I've come from. I learned from the people that were there, and I know that there's a lot of people that work in the healthcare industry, and they want this to be made right. And I hope that just as somebody simply keeps their medical bag nearby, and we can treat somebody or we can help somebody, that's all we can do, is try our best. Now, are we always equipped? No, we need a supply. We always need to keep a resupply. Because I know I could walk out of the street and I can almost guarantee I will find somebody that I can help. And that's basically what we've done. We've gone literally on the street and done it, and I hope we keep doing it and we don't stop doing it. So, anyway, so these are things that I've learned in the course of this. But, when you're dealing with people that have had a bad reaction to medicine, you don't want to leave them just stuck there. If there's a way we can treat them by the time they get to the hospital or whatever, I don't know. That's just been my experience as a, Army paramedic. And I work with a lot of people that know a lot more than I do. So I'm always learning. I never stop learning. But, one thing I know is the best way to calm somebody down is say, we're going to do our best to help you if you just calm down and hold on to my hand. And I've been on both sides of it. I've been in the medical care. So I know that you have to have a bedside manner and you have to care about your patients. And that's what I do. I never thought I would be doing this as a career for the rest of my life, but I figured at this point I should have just became a doctor and, whatever. But I'm learning how to be a doctor in the field. I just, literally, that's what it's like. We're learning right hands-on. And I'm learning more. I would like to probably learn it in the book, but, we have learned a lot of things hands-on. A lot of times I just wish we had more equipment, or I worked with more people like me. But having talked to one of my closest friends who's a Navy SEAL, I know exactly what we need to know when it comes to like this type of stuff, working in the field. But when it comes to in the military, which I haven't been in the military for a long time, I'm a civilian now, and I've been working at different capacities as a medical assistant, back office. So it's a variety of things. Unfortunately, we have been on the highway. We have been stuck without gas. We have been in situations. So this is life-saving information. If you don't know what to do, it's good to have some kind of idea or some kind of way to help get somebody off the street if they're, especially if, it's cold out and, people are dealing with hypothermia. There's just all kind of, I'd say right now, going forward, there's going to be weather events that we're not even ready to deal with. You're looking at extreme temperature drops, and I watch the weather. I watch space weather, and I'm trying to have a bit, not to keep my, not to be skewed by what's going on, but a lot of times the reason I follow the space weather and weather news is because I know what's probably going to most likely be one of the primary concerns. Like, are people going to be more upset? Are they going to be more stressed out? Or, what kind of, health concerns do they have? So I know what to expect and how to, in some ways, I know they're already diagnosed, but how we, take care of them and treat them properly. So it's a lot to learn, but I hope people do their homework. Don't just take somebody's word for it. Get a second opinion, third opinion, fourth opinion. Do your homework. There's a lot of great websites nowadays that, where doctors actually sell a lot of their own product lines, and I'll put that information below for anybody that wants to follow up on that. But there's a lot here, so hopefully people really do pay attention. The Court of Public Opinion is a part of the Amateur Radio Network.